I just want to take a moment a bit before we start the show, because once we start, I think I may not be able to do this. We have some sad news. One of our friends in the community lost her daughter this week, and it was so unfortunate because she got this news at when she was on a live stream that she lost her firstborn daughter, Shamila. So this is Walter's Sauce and More. Most of you know her. She's from the Jamaican community, and very supportive and supported a lot of content creators across the world. So Walter's Sauce and More lost her daughter this week, and it is so tragic. And the family is, I can't imagine even what the family has to deal with this message of grief. KP, Love, and you all know KP Love, and KP likes making fun of me on live streams and stuff. So KP was the sister, and then Walter, of course, is the mother, and of course they lost the first daughter. So I just wanted to take this moment to just ask us to observe 1 minute of silence, just in honor of her daughter, and I will say something shortly after the 1 minute of silence, and then we can start the show. So I will do this real quick, and then we can begin. So please join me, guys, in just observing a minute silence in honor of the lost daughter to Walter and Sauce. Thank you so much for observing that 1 minute of silence in honor of, Walter's and Saul's daughter. It's a very difficult time for the family. Blessed, my exclusive Yoga with Guga channel member, Blessed is hosting, she'll be hosting a special show in the next, I think, 4 hours, Blessed Life Journey. So you can join there just to, be able to give your messages of hope, messages of support to the family. They're going to host a live stream in dedication just, to the memory of Shamila. It's a bit tragic and unfortunate. And the best we can do is just wish that with the family, I just hope that the spirit of comfort will be with them during this difficult time. And thank you so much. Just go there. You can pass by Walter's Sauce and More and just leave a comment there, because I can't imagine what she has to deal with, especially with this loss. Just pass by there and leave your message and just tell her that you're with her during this difficult time. So thank you so much. Thank you so much. I appreciate you guys for just observing that minute silence in honor of the family. All right, I will now start the show. Welcome, Homecare Queen. Let me just put her somewhere nice, and she's here. That is our guest, Homecare Queen TV and Vlogs. You can search for that channel, but I've already pinned it. It's on the pinned link. I want you to do me a favor when you start in this conversation. I want you to connect. Oh, Julie is just telling me something there real quick. Let me just read that. Joy for Julie says, Goga, I spoke to Walters this morning. She's holding on. Yeah, I can imagine. Yeah, guys, you can just pass by Walters and just pass by there and just, commiserate with the family during this difficult time. All right, so I want you to do me a favor. One thing you need to do, you can watch these live streams at Homecare Queen TV and Vlogs. You don't need to be on my live stream. So I want you to leave and go click on the pinned link. It will take you to her live stream. You can watch the show from there. It is the same thing. Purely the same thing. So I want you guys to jump there so that you're able to actually follow the interview from there as well, so that you can give this beautiful lady support. I have known Homecare Queen, I think, for about 2 months now. I met Homecare Queen courtesy of Blessed. And I love this lady. And I remember I told her the first time I met her, I like you, and I think you need to come to the Sunday service, because usually what happens when I meet nice people on YouTube streets, I like bringing them to my community, because I'm like, no, my people, the tribe Goga needs to see you, because they will love what you're doing, they love your content, and they'll give you that bit of support. So I want you guys to like jump there before she starts speaking. You need to make sure that you've connected to this amazing woman. You will thank me later. So don't start asking me for links here. Goga, can you tell us the co-host link again when she starts speaking? Don't do that. Jump there. You can click on the link and go watch the live stream from there. You can comment. I'll be able to see your comment from here and I highlight it for you. You can even comment there. I want to appoint somebody. Hey, JD, welcome. Lady Posh, welcome. I want to appoint somebody to be on that side to just help me with the comments. Blessed is there. Blessed can help me with the comments on Homecare Queen's side, so that because when she starts speaking, she may not be able to like multitask and read the comments. But the Blessed is going to be welcoming you guys there when you land there. But I'll be able to see your questions, I'll be able to see the comments, and I'll be able to highlight them. And if you don't have our super chatter, Ramel, also feel free to connect to Ramel. He's very busy on the chat with his green jacket. Go there. We need to get Homecare to 800 by the time I end this live stream. Otherwise, I will hold you hostage. And I'm very good at holding people hostage. So don't make me hold you hostage at the end of the live stream. So without further ado, I will put Homecare on her nice solo layout, and then I ask her to introduce herself in the best way she knows how. Who is this queen? Why is she a queen? And are you like a real queen in real life? Some people already asking themselves these questions. So Homecare, without further ado, welcome to the community. It's such an honor to have you. Please introduce yourself to the tribe Goga. They've been waiting for this for the last 3 days.
The honor is mine. Help me here, Goga. Did I get it?
Yes, Goga. Goga, it is.
The honor is mine, Goga. It's a privilege and a pleasure to be here. And who is Homecare Queen? I am, first of all, a mother, a child of God. Oh, let me reverse it. I'm a child of God, a mother, a friend, a sister, a daughter, a cousin, and an advocate. An advocate for the voiceless, an advocate for those that are willing to create some type of change in their life and their environment. I enjoy cooking.
Ooh.
I enjoy cooking. I'm a fierce dresser. I love fashion. I love everything fashion. I love gardening. And I love to hike.
Oh, wow. Okay. I like. You wear so many hats. That's literally a lot. Just trying to synthesize. So I like one thing she said, that and I like how you gave yourself some of this. I'm a mother, I'm a sister, I'm a cousin, it was a very nice introduction. You said you're a mother. I mean, how many kids? Just curious for anybody, are the mothers on the live stream who are watching us?
I have 3 birth children, a boy and 2 girls, or a man and 2 women. I proceed by my son, who passed exactly 3 years, and I have 2 living daughters, 2 son-in-laws, no grandchildren yet. Guys, please pray. I want grandchildren so much. If it's even one, I've been asking the Lord to bless me. The girls are married, they're happy, and that's all a parent wants for their children, is for them to be happy. We're walking a rough path for the last 3 years, but we're walking it with God's grace. And because of His grace, I'm still able to smile. So I give Him all the praise.
I'm sorry, this is going to be a bit sensitive, because I'm so sorry about the loss of your son. And how old was he? I'm just curious, because 3 years ago...
He was 32 years old.
Wow.
32 years old. He was a professional chef. And he had congenital heart disease that we did not know about. He was not symptomatic. When he got sick, it was hard for him to embrace it. It was very difficult. He was 32 years, the prime of his life, just got out of college, just doing what he loves, and then he got sick. And we found out it was heart disease. He had a transplant. It worked for 3 years. They gave us 5. God gave us 3. And during the process of the 5 years, I had hoped that he would have continued to do well, but he got sick, and there's nothing that we could do.
Sorry about it. Thank you so much for that. And guys, you can send hugs and hearts, and it's very. I feel very emotional right now. You saying that, because if you lost your son 3 years ago and he was 32, that's exactly my age. I was 32 years 3 years ago. So I'm as good as being your son right now. So I feel I can't imagine, that's because I feel I'm in my prime and everything, and there's still a lot to be done. So I'm so sorry about that, and I just hope that the family keeps finding comfort, and I hope you get those grandkids one of these days. Yeah.
So let me say a quick thing about Walters and losing her child.
Thank you.
I can put myself in her space. It's the worst space to be in. But what I know about her, the little I know about her, she knows God. And that is the only thing that's going to help. Trusting God that whatever happens, He will pull you through it. But the bigger message is look at what can be done moving forward to make yourself a better parent, a better person. When our children passes, we are not the cause of it. However, there's a lesson to be learned, and taking the time out to learn the lesson is what's going to help the healing process. There is this myth that time heals wound. It's a lie. Time does not heal that type of pain. What I have done, and I can talk about me and continue to do, is to build a new avenue around the pain. So I build a life around the pain. My new normal, I call it. I build a new normal for my life. I do a little more for others. I'm more merciful. I'm more understanding. I'm more forgiving. I'm not perfect. I make errors. I make mistakes. But the goal is to build a new normal to make a better space.
Thank you for sharing that. I want to take a special moment just to acknowledge Mama Ifechi for the raid. I just got a raid from Mama Ifechi family. Thank you so much, Ifechi, and all the people who are in that flight from the United Kingdom to Kenya. I see Funke, I see Naomi, I see Musisi, I see Estelle, I see all my people in that flight. Thank you so much for really making it and coming to share with us this space. And you're most welcome. You're most welcome, Captain Ifechi. Ifechi is also my channel member, guys. If you don't have Mama Ifechi, and she has co-hosted the live stream before the Sunday service. Mama Ifechi, thank you so much. You had a lot of options, but you selected this humble house. I am honored, and I really appreciate the read. Thank you so much for the read. That was a very heavy introduction. But I think sometimes it's important to just recognize this, and and thank you so much also for just sharing that, because I think I always feel like some of these things are deeply personal, and I can bet like 90% of people didn't even know that fact about you. So it's really an honor that you shared with us that particular information. So Homecare Queen, the first thing I want to just ask is, I love the name Homecare Queen TV. It's just, what are you thinking? Just like I like asking people their thought process on their YouTube names, because there's something bold about calling yourself a queen. What inspired this name? Just before I get into the questions I wanted to ask.
Well, I've been in the mental health and medical field for over 42 years.
Whoa, okay.
And, that's a long time.
It is.
And you get criticized, you get praised, you get, encouragement, and you get life lessons from your job if that's what you want to do. So I went into home care about, I think this is my 7th year, not from the hospital level or the nursing home level, the private level. And one of my clients, we were talking after her husband passed.
Yeah.
And she said to me, because of your care, my husband was in the best space. He got the best care. And Queen, I honor you.
Wow.
And and this was years ago. Yeah. And I said, thank you. So I didn't decide to do YouTube. YouTube did me. I was I was watching a content provider one night when I had some time.
Yeah.
And pardon me. And when I listened to her, I started to watch others, and I'm like, okay, this is different. There's a space here to advocate. There's a space here to form a community. There's a space here for me to learn cultures and learn, how people function and do things.
Yeah.
So my girlfriend came to visit about a month after that, and I was showing her.
Yeah.
And she said to me, you have YouTube on your phone? And I said, yes. She says, okay, go on it. So I picked up the phone, I went on it. And she says, let's look there has to be a live button. So we looked for a live button, and I went on and I go, hi, hello, everyone.
Yeah.
There was no name, there was nothing. And people start to pop up. And I go,
wow.
Are you kidding me? Not knowing that she was texting friends to come on. And then we came off shortly after that because it was a joke, And I sat down one day and I said to another friend, there's this YouTube phenomenon going on out there where it's advocacy, it's discussion, it's socialization. And the friend said to me, well, do one. And that's how it was born.
I love it. I love it. I love it. It was, and I like how you said, it was out of what you used to do. So 42 years in the game, Blessed is requesting you to make Anne Maura a moderator so that she can help you welcome people on the other side. Because I know she has to.
Who?
Official Anne Maura, just make her moderator. Maura, you can type something there so that she can help me. I'm appointing Maura to help with the welcoming there on the other side. Yeah. So 42 years in the game, is this did you find yourself in home care throughout your life, or maybe because you said you're in the medical space before you or did you was it the medical thing before you transitioned into home care?
Yes, I was emergency room trauma certified CNA.
Okay.
And while I was going to college, I got married very young. So I worked my way through college. The hospital supported us, would assist us with tuition. I wasn't going to pass that one up. So I worked as a trauma CNA for about 20 years. Then I moved to bedside nursing. Let me clearly say, I am not a registered nurse. I am not an LPN. I am a proud nursing assistant, certified caregiver, and I also have my professional life. So after 9/11, I decided that I needed to change the environment. I needed to bring the kids in another space where it could be safe. So I ended up where I am, and worked here in the professional world for a while until the kids were finished with college. And then I sat down and said, okay, what am I going to do now that I'm retired? So I retired then, and it was my daughter who said to me, you have so much to offer. And she says, Mom, can I have your resume? She's a shrewd businesswoman. And she took it and she turned a 4-page resume into 4 paragraphs. And she said to me, home care is the thing where we are. Why don't you use your experience and do that? So that's how I started to do home care. And let me say, when I talk about home care, I'm talking about individuals that are certified, that goes into the home and care for people. There are care providers who are not certified. That's your issue. That's your space. If you're happy in it and you can get work in it, be proud of it. So I started to do private home care. So I used the term that the client gave me in the professional arena, queen. I said, okay, I'm going to be the home care queen. So that's how Home Care Queen came about.
I love it. I love it. So I like that because, you know, after being an NA and then you transition now after retirement, you know, it only makes sense. I think, you know, just thinking about it, I totally resonate with what your daughter did, and you know, but I love that girl already. I'm curious, where is Home Care Queen from? Because you said where you are now here. Where are you from?
I was born in Jamaica.
Nice.
I was raised in New York. And now I'm in the West.
Wait, born in Jamaica, raised in New York. When did you guys, like, I mean, if you're born in Jamaica, when did, like, the family or maybe yourself, you guys leave Jamaica? Just for anybody who may be curious.
It's a long time. I constantly have to ask my sisters. I remember it was a Christmas. Dad wanted us to experience the snow during that time. So our Christmas present was coming to the US to join him and mother.
Ooh. That must have been
Thank
a
you,
long
Miss
time.
Wendy.
Yeah, that must have been a very long time.
Let me, what is this? Let me quickly say that I became a professional and continued to do CNA work.
Yep.
So through school, through upper education, I still maintain, because a skill is so important to have just in case, like you retire or there's an illness and you can't work in that particular field, then you have a skill to rely on. So I maintain my skills and my training as a CNA.
Awesome. Thank you so much for that. What else? I mean, home care as I like, and you say your daughter said that this is the thing, and, you know, tap into the skills of, you know, the skills that you had to use for the last nearly 40 years, for lack of a better word, you know, into, you retired, yes, but you're not retired technically, because you literally continued doing what you're doing. Ordinarily people retire and, you know, they go, I'm going to enjoy a vacation, but it appears you continue doing, you know, what you are doing all along, but just in a more intimate and private setting. What inspired this move, rather than, because some people when they hear retirement, it's like a card for just to go sit and, you know, enjoy the fruits of your labor, for lack of a better word. Yeah. So what inspired you to keep, you know, to keep like actually applying your skill rather than just resting and, you know, the kids are all grown up? Why should I bother?
You know, I can't stay still.
Okay.
I cannot stay still. I always, if it's not humanitarian work, volunteering, advocacy, I have to be doing something. And before my son died, I was a little bit laid back because he would say to me, "What's wrong with you? What are you doing this for?" And he would, holidays and birthdays, he would come over, you know. So after he died, and I used the word died because he did not pass for me, he died. Because died for me is more comforting. So after he died, I hit one of the darkest spaces any human being could hit. And when I came up for air with spiritual support, family support, and mental health support, I decided that I have to make a difference. I have to make a difference. I start to volunteer in food banks. I have a humanitarian project, No Butts Left Behind, providing Pampers for mothers who are on the welfare system, providing Depends for elderly people who cannot afford it. So I just decided to throw myself in volunteer work.
Wow.
Most of what I do, I say work because it's still work. It's voluntarily. It's my humanitarian work. It's volunteering in the community. Whatever I find to do, I do.
Interesting. So home care generally, maybe to an external observer may not understand what home care is all about. And for me, I think, and I was interviewing somebody who also retired from home care, like I think it was last month, Gianna Bradford from the United States as well. And she told me she was also in the space of home care. And one of the things that the consensus generally around home care is that, you're literally in the service of others. Service doesn't come naturally to most people, especially because when I think of home care, I feel like this is literally you assisting someone even in their most vulnerable self. And most people don't have the, for lack of a better word, the grace, to get into that particular space. So what would you explain to somebody who doesn't understand what home care is all about? Like in very few words, in your own words, as an experienced, queen.
Home care. So let's start with home. Home means you're going into someone's private space to care for them. In order to be the best you can be, you have to have a passion for people.
I love
the
that.
people that has done the best in this profession are the people that are passionately caring. Folk who can take a criticism, go in the bathroom, drink some water, take a breath, and restart with a smile. Folk who can be tender in situation that deems uncomfortable. There is a job, and then there's passion. Job is working for money. Passion is working for what you love and getting paid for it. So when you're passionate about something, anything, this is something in your gut, especially for us women. If you are a cook, and when you cook, everybody eats and licks their finger or say, "Wow, I've never tasted this before."
Yeah.
Tap into your passion. And someone asked me once, how early can you feel your passion? You can actually feel your passion up to 12 years old, 10 years old. If you have a child that loves to paint, you have a child that every time you turn around, they're in your shoe. Don't push them away and say, "Come out my shoe." Maybe that person is going to be the next fashion marketer. Maybe they're going to be the next person that works in a store selling dresses and selling shoes. They know how it feels, they know what it looks like, they can recommend. So tap into your passion very early and build on that passion through life. Can passion change? Yes, it can. Well, I could say it can grow. It doesn't change, it grows. It develops as you get older. So if you decide to go to college, you know, okay, this is what I want to do. This is what I like from I was a child. So I'm going to master it and I'm going to do it. So that's the difference with home care or any profession is passion. There, I have seen people through my work life that I'm only here for the money. It happens more often than not. But the people who are passionate about home care, who are passionate about caring for people, let me hasten to say, 2024, home care is where it's going. Families no longer want to put their loved one in a nursing home, especially those that are wealthy. They would rather pay a special person that they build a relationship with, that has the skill and the dedication to come in and take care of their loved one, than deal with 500 people for the week coming in their home. So let me hasten to say that if there's anyone here who has been doing this and it has worked for you and you're happy in it, and you're able to manage your life, medical is the biggest reason why individuals do not go private. If you are growing young children, you're going to need medical. Home care, privately, you have to provide that medical for yourself because family does not do that. The other thing is, if you get sick on the job, if you hurt yourself on the job, my experience, I don't know about others, my experience, I got hurt on the job once. I fell in their bathroom and I was sick, and they paid me for the duration of my illness because I got sick in their house. That's not the norm. So you have to be prepared to go into private home care. And once you're prepared, you have a husband or a lifetime partner that is very supportive, has medical for the children. You've been working for an agency for 6 and 7 years. If you can get out and go independent, this is the year to do it.
That's actually very insightful. What would be the requirements other than, I know you said passion, and Kisha is talking about how, you know, her relatives are in the space of home care as well because of how they're always willing to help. Are there other key qualifications that in case somebody was not, like, let's say a nursing assistant or maybe a retired nurse, you know,
retired nurses go into home care on a different level.
Okay.
We're talking about the individual that has done this on just a nursing home level, a hospital level, agency level, that doesn't have the higher education as a registered nurse. Most registered, they're in a class by themselves. So in order for them to do this, it's so easy. They're a registered nurse. But an individual who is certified in your state or in your country, the key to getting individual to trust you and to work with you is having your credentials. You get your CNA license in some states, and this is one thing I forgot to research, but I'm almost sure in most states, in my state, even if you're a certified nursing assistant, when you're going in the home, you have to become a certified caregiver also. Why? Because the certified caregiver is trained on an entry-level basis. When I say entry level, you're trained how to take blood pressure. You're trained how to monitor the client's vitals. You're trained how to prepare a healthy diabetic meal, how to prepare a cardiac meal. So that's the home care step. You're trained how to keep the person's space. Let me hasten to say, when I say the person's space, it's the bedroom they're in, the bathroom they use. When you feed them, you wash their dishes, you clean back the person's area, especially if they live with a spouse or a family. So if you just fed Jack and Jack lives with his wife, you wash Jack dishes, you put them away, you turn around, you clean the area that Jack leaves, you keep their space. You're not their housekeeper. And caregivers, I hear a lot of this. Do not let them, or because of the fear of losing your job, you become a housekeeper. If something happens to you while doing job outside of the certification, you're not covered.
Ooh, that's a very
So
important
do not let the fear, oh, I can't lose this job. This job is paying me $20 an hour. I was getting 15. Don't let that fear let you set up boundaries, because if you're tactful and if you're caring and speaking to the family member, they go, I'm sorry.
Yeah.
See? Because any space you go into work as a care provider, believe me, the family knows the rules. They have looked it up. They know the rules, but they're like human beings, they're going to push the boundaries. So your job is to carefully say, I would love to do it, but I'm not able to vacuum because of my barriers and boundaries for working. And the individual might say to you, but you vacuum my husband's room. That's because that's my workspace. And I have to keep it clean so I keep him in optimal health. So there's a way to get around it. You don't have to lose your job. It's all about how we handle things. It's all about how we respond.
Makes sense. Challenges and rewards when it comes to home care. What is there like? What would you say was your most challenging moment, especially in this space? Because I'm just trying to imagine people are difficult, Queen, and and families sometimes have like very sometimes unrealistic expectations, and I'm just trying to imagine. What is that one challenge, that is in this space? Before maybe I ask for the reward.
Let me say this. For me, coming from the space that I was in employment and choosing home care was very humbling. Some days it was very distressful when I first started. When you've worked in a professional environment and you're going into something that it's new because of the context. I worked in hospitals, I worked in nursing homes, I worked in professional mental health offices, So because I carried two roles, professional CNA and then professional mental health individual, it was very, very difficult to walk into someone's home and be called gal. It's a very common statement.
Girl.
The gal I have working for me, she is so nice. The gal I have working for, that was so hard for me to take in. So it took years, it took time. It took feeling confident in myself to address it. The other thing was, get this. Get my coffee.
Ooh.
You didn't do this. So I was spoken to like an object. I'm paying you to work and you are here to work, and so I'm not bonding with you. I'm not developing a relationship with you.
Ooh.
you're here to work, and that's what you are. You're my worker. That was very, very hard to deal with. I've had people ask me, why would you do this?
Yeah, I was going to ask that next, actually.
I did it because I want to put a face on home care. I want to put a positive face on a negative avenue. It can become very negative. Some individuals used to, it's getting better, see home care workers or nurses aid, as they were called, or HHA, as uneducated people who cannot find a job, who has no other choices in life. So I wanted to put a face on home care, that it's a profession, it is a good profession, it is a respectful profession. The challenges that you have in any work environment, you will have it. However, the toxicity that you find in working for an agency or working for a nursing home, working in a hospital, is not there because you command that space. You don't have 5 people working with you. And if you leave a towel on the floor, instead of come to you and say to you, listen, you left the towel in Jack's room. I know you're busy, but could you check before you leave the room? They go, they tell everybody in the lunchroom, everybody in the parking lot, and then everybody's against you. So working in a private space gives you the opportunity to steer your own ship.
I like that. And you have amazing comments from Miss Wendy. Miss Wendy says that she's trained in home care dialysis treatment, and so she really resonates with what you are saying when it comes to the steps one needs to know. And then Kisha was watching us from South Carolina, says, I had a surgery in November 2023, and I was so fortunate that my younger sister was able to come and provide home care for me, changing bandages, letting me get in my meals, and so on and so forth, helping me dress. And Maura, who is your moderator on the other side, Maura can relate because Maura has also been through this. She before she left the Gulf to come back to Kenya, and it's interesting how people are like coming through this. Mama Fisher is asking you your first question. What will you do if the client doesn't have the money to hire a housekeeper and family is not there for them and the house is really dirty? And I think she's asking this, I guess, coming from a place of you are not the housekeeper, you are here to clean your space. And I think that's a very good and solid question.
Very, very good question. I appreciate that question because I found myself in that space. Yeah. I found myself in that space when I started. Where I went in home care, because it's a ladder. So I went to luxury home care. So while I was climbing the ladder, yes, when I worked for the agency, because in order to learn, I had to go through the agency. I had no experience with this type of work. So when I worked for an agency, I walked in a house. I always have a bag in the back of my car, change of clothes, booties, and those of us who works know in home care knows booties to put over your shoe. I have a cap to put over my head, and I don't leave home without my gloves. And before mask came in, I was masking. I mask up, and I did clean that house out. I would never, ever encourage anyone, because of the boundaries of the scope of your practice, to leave somebody in filth. I would never encourage that. However, if you work for an agency and you find that, report it to your coordinator. Because the coordinator has somebody on file as a contact person. The coordinator will then reach out to that family member or friend and says, the house was in a terrible state when we got there. Could you keep periodic check? Because my staff is not supposed to do this on a regular basis. But yes, if you walk into someone's space and it's dirty, do not leave them in the mess. Great question.
I like that. I want to just circle back now to the to what you
Hold
said.
on,
You wanted,
let me just answer one question on your side. Could
yes.
you highlight it? Cherish him.
Cherish
Cherish
says, yeah,
him.
I was actually going to that one. Cherish says, home care or caregiving profession is very challenging and draining, especially when dealing with the ones with acute dementia. At times, they can be vocally aggressive or even physically aggressive.
Okay, and again, great question, you guys. And this is what I need. I need you to ask the questions that you're having challenges with. I'm also going to ask you guys to share some love on my life.
Yeah, guys, please support the co-host. I want you to, don't worry, let me blackmail them for you. If you are, I will not highlight your question if you don't post it on Home Care's channel. I'm just kidding. But I want you guys to jump on the other side. Go watch the live stream from there so that you can also support her channel. Give her a thumbs up. I know you guys love being here, but guys, there are no receipts. It's the same live stream. The live stream is also streaming on Home Care Queen's channel. You can go watch the live stream from there. Type something there. I'll be able to highlight it for you. I can see all the chats. I can see all the questions even on the other channel. Jump on the other side. Jump on the other side. If you want to ask a question, jump on the other side and then I will highlight it. Let me get you guys to connect there. Jump. I'll be able to see. Okay, guys, cross the other side as she responds to this. All right.
Yeah, they're not supporting at all. So, Cherish, when we are dealing with dementia, especially acute dementia, if you're working for an agency or if you're working in a nursing home and the person becomes aggressive, first let me backtrack. Remember, the disease process is changing for the individual. Most of the time, they're not even aware of what they're doing. Some are not. What I would encourage anyone that is working with dementia clients or any client, behavioral, any client, take some time and school yourself on the disease. Because once you school yourself on the disease, read up on the disease. Do not treat the person like the disease, but read up on the disease so you're able to, you can spot what triggers them, and that's the word, triggers. Sometimes, in my experience, it's your perfume, it's your high-smelling lotion. We're women, men too. We love to use our nice-smelling perfume. But when you're working in certain areas, certain specialties, have to be careful, especially in the home. You have to be careful of the scents that you use. Some people, they're triggered by that smell. So, and when we say trigger, we're talking about, it could remind them of a husband that passed. It could remind them of an ex-boyfriend. It could remind them of an abusive relative. So because you wear that perfume doesn't mean that they don't know what it smells like. So when we're dealing with behaviors, we have to find out their triggers. And the more you read is the more you're going to be able to cope. The other thing is, know the triggers for the moment. So if you're feeding the person and when you pick up the spoon to give it to them, they smash it out their hand. Don't say, stop it. I'm here to help you. No, they want to do it themselves. So what you say to the person is, do you want to feed yourself? If they decide to use their hands to feed them, there's nothing that says that they cannot eat with their hand. A lot of culture eat with their hands. So because we're cultured to eat with utensils, doesn't mean that the individual, when they were a child, they pick up the food by their hand. And remember, once a man, twice a child. They revert back to those behavior. So, know their triggers. If you're feeding and they're constantly, which they do, you have to know within yourself that this is not working. So it's not about you, it's about them. You are rushing to feed them so you can go and do something else. Meal times is time for them. So if you put that fork down, and try it if you have these patients to deal with, if you put the fork down and say to the person, go ahead and eat, watch them use their hands. I have seen people put their mouth in the plate. People, they're sick. It's okay. The goal is to get nutrition in their bodies.
Wow.
If they're hitting you, here's what I've done in my past. I would sit the person down after they have been medicated. They have an hour and a half span before the medication happens. Then they're calm. During that calmness, you go and say, hi, Mr. Jack. Hi, Mrs. Jack. How are you doing? And let me say this again. Do not call adults baby, sweetheart, dear. They are not your babies. They are not your dear. These are professional people. These are mature people. Call them by their name. If her name is Sandra and you say, hi, Miss Sandra, and she said, you can call me Sandy, you Sandy. But so many times I've heard people say, oh, I treat her like I treat my mother. Stop it. Stop it. Stop it. Because the way you treat your mother, you cannot treat a client. You cannot go and hug and kiss on a client when they're upset. You can do it to your mother. Because you see, times are changing, things are changing. Whatever we think was normal is now not normal. Yes, the perfume smell, your attitude. Thank you, guys. Keep them coming. Your attitude, the perfumes. You walk in the mornings, you drop your pocketbook down on their couch. Hi, you ready for breakfast? How do you think you're going to be able to manage that person at breakfast? You never greeted them. You never let them feel loved or appreciated, or that you even miss them. And let me say, loving someone does not mean that you have to hug and kiss. It's a touch. It's a pat. Because you always have to be cognizant of the time we're living in. Maybe they don't want you to hug them. Maybe hug for them is a trigger. So you hold their hands. You learn your clients. If your client is someone, I had clients that as they see me, they hug me. But it took me time to be able to embrace that. Because I need to know they're comfortable with it. When you're feeding or assisting a client to eat, do not talk about, you peed in the bathroom earlier, and I want you to keep your depends on. Do not use mealtime to be a war. Because then they will never eat. Because when they sit at the table, they will remember that you yelled at them. So those are some of the ways we can decrease behaviors.
It's clearly now it's emerging how it really has to be a passion, and rather than just a typical job to tick the box, get paid, and go home. Nice to see you, my girl Mlongo. That is formerly Fabulous Aunt. Fabulous Aunt is a nurse based in Sweden, and she can totally, and she started and she's really grown through the ranks. So that's why she's really resonating with everything you're saying here, because she's literally done home care before getting into that hospital setting, and she keeps doing an amazing job there. So welcome, Fabulous Aunt. Nice to see you. I want to just ask, what about the rewards? And I know you talked about the client who called you queen, and but before I ask about the rewards, I'm very curious about the kind of, are there like different types of home care? Because I know that, like, what about terminally ill, families with terminally ill, patients who are trying to recover at home. I'm just trying to like wrap my head around it. Are there like different forms of home care that maybe for somebody who is learning about home care for the first time like me that, it's great to be aware of before I get into the rewards?
Well, they're not different forms of home care, because remember, home is where you're caring for the individual. So wherever a person call home, they could be in a hospital with a broken hip, but there's not enough staff to help them get up and go to the bathroom or to keep their company. They love to have someone in the space to talk to them and watch TV with them, because when they're home, they have their husbands and they have their family. So when they're in the hospital, they'll still use caregiving services. Now, home care is going into the home wherever they call home again. So the disease is what makes the difference.
Okay. I'm guided.
So
Okay.
you have an individual that has heart disease. This individual needs constant monitoring. The family can afford to keep them at home and care for them. So they hire someone who is certified and who is experienced to come into the space and care for them. And then you have someone with a broken hip, not able to ambulate on their own, walk on their own. They're not able to cook for themselves. They want to go out to the movies. They want to go out to visit friends sometime. You're there to be their support. Now, you talked about the people who are terminally ill.
Yeah.
Those are hospice care. Hospice care is given with a specific service. However, while they're on the hospice care, they're going to need someone who is certified nursing assistant, a certified medication manager, who is a caregiver, to give the pain meds, to take the vitals, to make sure that if they get in crisis, they can call the family member or call the hospice team to come in and help them. So it's the disease that makes it different. And every stage of the disease, the pay is different. So this is why I would encourage folk that are out there that are experienced, that has medical. If you are able to go private, it can be a very, very rewarding, financially rewarding, spiritual rewarding, professional rewarding space to be in.
All right. And I like what I'm just highlighting that. I think that's a great Longo is buttressing what you're just saying about boundaries when it comes to the hugs and whatnot. So thank you so much for saying that. I'm curious now about and I like, guys, I hope you're getting something from this, because I think for me you've totally demystified home care. And now I'm just trying to think about it, because I remember we did have a patient in 2018. One of my family members just after coming out of intensive care, after suffering a stroke. And I remember this lady, I never used to understand, because I think it was a very dark time for us as a family. And I remember this lady used to come every single day. And I remember the house manager, the duties were very distinct. She was the home care giver. So it's just now registering in my head. It's just that I didn't, I think, understand what she was doing. But I know her space was always the bedroom, because is where like our patient was. It had to be clean, the medication, the food, and everything. I'm kind of now getting the whole thing, until our patient fully recovered and is now back to what they are doing. Cherish is saying,
yes, I was asking you to grab her. Yeah.
Cherish is saying, I work in residential home care. We have ones with full capacity and the ones with dementia. Some of them are racist, and they are in their full capacity. And no matter how good you are to them, I think she was just finished that thought. It's hanging. I guess goes into the challenges.
So let me say that first we have to identify our own ethnic boundaries. and our ideology on racism. Okay? Because what determines racism for me, except that is legally binding, let me put that out there. The law has described racism. If you come across that on the job, that is something that must be reported immediately. Is it that the person is calling you out of context? Black woman, mango tree, apple tree. If that is the issue, that's a behavioral issue. So you need to sit that person down, look them in the face, lower your voice, and let them know this is unacceptable. My name is Savannah Marr. I would like you to address me by that and no longer by these terms. Because if it's racism and you clearly makes you feel out of space, clearly diminish who you are, it needs to be reported right away. It doesn't matter who the employee is. Once they have diminished you culturally, sexually, socially, that needs to be reported. Because if you hold on to it, then you develop, especially in group homes, where you're seeing these people in a space that it's you and them on a daily basis. You have to deal with them on a daily basis. If it's something that it's a behavioral issue, nip it in the bud.
All right. Okay. So, guys, I want to transition into now when it comes to home care, because you're dealing with people, and and I like how you brought off. I think I like how everybody's contributing into this conversation, especially on the challenges when it comes to home care. I want to now just ask you, in your experience, especially having been in this space for a while, are there like some self-care, self-care activities that at least you use for yourself? Because especially because I feel I don't know how long the hours, assuming that you have to do this on a day-to-day basis. Do you get time for yourself just to also just settle in and just settle yourself down, especially after a long day? Or maybe if you have very difficult situations like Cherish, how do you bring self-care, especially as a home care provider, and why is it important?
Let me first say, if we cannot take care of ourselves, we cannot take care of someone else. You are the priority in order to give the service effectively. So I have been in spaces where individuals pick up every overtime. They don't take a vacation. Every holiday they're working because it's time and a half. I want you to listen to me carefully so you don't go away with the wrong ideas. How you run your life determines how you cope. So if you're not taking vacations, if you have small children going to school, if you work 7 to 7, you have to pick them up from the babies in the mornings. You have to drop them off at the babysitter. So you're getting up about 5:30, 4:30 to get to the hospital or the nursing home by 7. You have to drop the child off by a friend or the babysitter. Then you jump on the train or the bus or your car and you get to work. Give yourself some space before it's time to clock in. You have to clock in. I know most job wants you to clock in at 5 minutes too, so the clock align perfectly for your 40 hours. Get to work 15 minutes early. Grab something from home, an apple, a cup of tea. Sit in your car for a few minutes because you just worked before you got to work. Sit in the car for a few minutes, have a sip of your tea, eat something, breathe, then go in. Because those of us who work in the field knows they just have to smell you coming off the elevator and they have the clients ready for you. So you get there and it's time for report. You got to get to report. And after report, you got to go and relieve the person who is on a one-to-one. We have no break. So if we do not take the time to take care of ourselves, taking a vacation, you don't have to go to Europe or Paris if you can't afford it. Go on a staycation. Staycations, hotels, gives weekend packages. Just go, spend the time with your loved one, spend the time with your special person, or if you're a single mother, spend the time with a girlfriend. Go out for coffee, go jogging, go walking, cook something at home for yourself, set your table like you're having the queen visiting, and sit and enjoy your meal. You see, because if we don't take time out, that's why we get burnt out. That's why we get yang, 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 yang on the job. That's why we have no mercy. As I said before, somebody just leaves something in the wrong space, you're ready to report them. Remember, every person that walks into that job has bills like you. They have responsibility like you. So the goal is not to get an individual fired. The goal is to let them know that I need you to take a break. Go sit down. You're tired. You're leaving things all over patient's room. Develop a buddy system. And when I say buddy system, I don't mean someone who cannot tell you you're wrong, because it seems as if that's another topic. That if you tell somebody you're wrong, all of a sudden you hate them. All of a sudden you are jealous of them and you're envious of them. Lies you tell yourself. People that correct you are not jealous of you. They're just correcting you.
I like that.
So take time out for ourselves. Take a break. So if you decide, okay, Christmas, I'm going to work time and a half, because I did it. I love my time and a half. Those checks are good. But then I'm not working New Year's. I'm not working New Year's. Thank God for states like Atlanta and New York and Chicago. And I think there's a Rhode Island and a few other states where we are unionized. We get a 4 weeks vacation. Guys, you get 4 weeks vacation and you use 3 for overtime? Are you kidding me?
Wow. Okay. Makes sense.
So what I used to do, I would go on my vacation, take a couple shifts, and then I'm off for the rest of the vacation. And the other thing that I did, he asked me what I did. I never took my 4 weeks at a time. I would take a week every 3 months. So take care of ourselves. Do your bubble baths. You're saying, oh, well, we don't have the money to do that. What you're talking about is expensive. Take a bubble bath. It's the nicest feeling ever. Do you know you can go to the rose shop and buy petals, fresh rose petals for $2? Instead of them throwing them out, they make, well, now I think they're like $10. But do something for yourself. Take your bubble bath. Have your facial. Do your own facial. My favorite homemade facial, olive oil and brown sugar, and that will cost you all a subscription. Okay? Do your own stuff. Take time to rest.
I like this, guys. And thank you so much. I'm glad I chased people out of my live stream to go support Homecare Queen, and I can see all of you there. Perfect. If you're on my live stream, you can watch the live stream from Homecare Queen's side as well. I can see all of you, all the 32 of you right now. I can see all of you even from my end.
I appreciate you guys. I appreciate the support. This takes work. This takes research.
Yeah, make sure you give us support. Subscribe to the channel as well. Don't just be enjoying the hanging out there. Subscribe to the channel as well, because I want that channel at 800 by the time I finish the interview. So make sure that's a directive. That's a directive. Let's make it happen. Mixed Plate, nice to see you. I see less incentive there in the building. I see Blessed Johnny Maura, you're doing an amazing job welcoming people there. Thank you so much for taking up the mantle. God's Child TV, nice to see you, and happy birthday once again. JD is just bringing to my attention that you are observing your birthday. Yep. You said something about taking care of ourselves, and I think I like that, because then that goes into the space of mental health, because True Mamle just mentioned it right there on the chat. And one of the biggest one of the things that most people grapple with is literally that taking care of ourselves. And you gave an example that you get a 4-week vacation, you use 3 weeks for overtime, because, and something like saying, just to be able to get in that extra money or something like that. And you also said earlier in there, when you're introducing yourself, that you've been in a space where you work in those mental health offices and spaces. And one of the biggest challenges that we are talking about in 2024, and even companies, organizations. The other day I was attending a conference at the coast, and they brought this speaker. She's actually like a psychologist and everything, and she had to like do for us a mental health assessment, and sensitize us when it comes to mental health. And what has been your experience, especially? I'm trying to use now your immense 42-year experience, especially in these mental health offices. Is mental health is it what the world makes it look like, or why are you why is it important to advocate for mental health, especially in this time and age?
It's so important in this 2024 season. Because remember, we experienced the big orange crap, where so many people lost loved ones. We were locked in our homes for months at a time, when we're used to going out to work, we're used to going to see our friends, we're used to going to the supermarket, we're used to going to church. We had to do everything online. So that in itself creates stress. I know for me, it was very stressful not able to go about and do what I do. I didn't take vacation for 2 years because of that experience. I didn't see my family. It was very, very hard. Yes, I was able to FaceTime them and talk to them, but it wasn't the same. I missed their hugs. I missed the camaraderie of my friends. I missed my church. So when you have been taken out of a space where you're socializing and you're thriving, and you're thrown into a space where you're just locked in, let me tell you, unless you guys are from another terrestrial zone, it takes a toll on you. It really takes a toll on you. And what I'm finding, and this is my experience, what I'm finding is that people are now colder, they're apathetic, it seems as if you can't make a mistake anymore. If they're so critical of you, the simplest thing you do, So understanding yourself, understanding what you can cope with, knowing your own triggers. I just learned mine 2 years ago. I thought it was whatever. I'm not paying that person any mind. But what I notice is when I'm in this group, I am my worst self. So I had to do a total examination. I had to go in that refrigerator and take out the bad foods. And I started to look into myself and says, why do I behave like this around those people? They were my trigger. Once I recognized that, I was able to manage myself better. In the mental health profession, mental health includes our emotional, our psychological, and our social well-being. If we look at mental illness the way we look at heart disease, diabetes, cancer, we'll make a better place for each other and ourselves. The person is not cuckoo. The person is not cray cray. The person is not Looney Tune. Let's get rid of those phrases.
True, 100%. And guys, before I ask Homecare Queen my next question, I just need to give a disclaimer. The conversation of mental health is very sensitive, and it's a personal experience. Everyone's opinion counts. So even if you may not exactly agree with what we are discussing here when it comes to mental health, kindly respect any other person's opinion. Just just as a disclaimer. And also, this conversation is not intended to replace your doctor's advice or your personal decision making when it comes to your mental health. It's just we are just talking about experiences, and it's important to just put these ones out there so that at least the expectations are very clear. One of the things, Homecare Queen, when it comes to the mental health conversation, and I've been seeing it especially a lot in this platform, is content creators are getting stressed. It is the pressure, let's say, to perform. Like Goga comes on live streams like 3 times a week, and if I fail to show up, I'm like, I really have to show up. And sometimes that may even come at the expense of my mental space and state of mind. Burnout. You have to do videos, edit them, and you have, like, maybe you have an upload schedule, and you're like, oh my God, Wednesday is approaching, I will not have finished this video. So that pressure in terms that that leads to burnout, doing the same thing every single week, and you get less motivated with time. Sometimes it's in the form of harassment, especially from people, trolls. You're being bullied in your own space, especially as a YouTuber, and I've seen that a lot in a number of some channels. Sometimes it's comparing yourself to somebody else. It's like, why does Goga have that kind of microphone? Why does Homecare Queen have such amazing visuals in terms of camera? Yet we are not at the same place, when it comes, economically, for a reason. Maybe I'm from Africa. There's certain things I may not have that a YouTuber, let's say, based in the United States, gets to enjoy. Isolation and loneliness sometimes, the long hours you spend editing videos, you are mostly alone in those particular times. And sometimes you never know your life outside this particular platform. You're like, I need to be on the live stream because my people are there. Yet you have family, you have friends outside this particular platform. What are some of the things that, as content creators, especially, and you have just joined YouTube, and I'm sure you're already getting a raw experience of how it can take a toll. What are some of those areas that you may want us to watch out for as content creators when it comes to our mental health? And mental advocacy, for me, I look at it in terms of, even us as content creators, we have to be very vocal about these issues. We can't sweep it under the rug. We have to acknowledge that, yes, there's a problem. If I'm not feeling okay, do I really have to show up? Can I get somebody else to hold the space? Can I tell the community I am not at my 100%? Let me sort out something, I will be back. But tell a content creator that, they're like, no, I will lose my subscribers, I will not find them. It almost becomes like a cycle, an addiction, like a dopamine of sort. Like, I have to be there. Yet, if you ask me 4 years ago, when I started my YouTube channel and I had my 100 subscribers and no one watching a premiere or a live stream, I never used to have this problem. So what are some of the things that, in your experience, especially having been in these mental health spaces, that you could, speak to us about, especially as content creators? Because 90% of the people watching us right now are content creators, and they're probably like, Goga, where are you going with this question? Goga, where are you going with this question? Because you're talking about me.
Okay, as you said, I've not been in this space long, but I have observed, I've listened, I've read comments, on my channel, other channels. I'm trying to put this in the most diplomatic way, because sometimes I can be very sharp.
Yeah.
Your channel should depict who you were before you came on YouTube.
Whoa. Say that again. I don't think I heard very well. Say that again.
Our channel should depict who we were before we came on YouTube. It should be in alliance of who we are, what we stand for. The number game, as you said, it's real. Everybody, including me, would love to get to where it's like, yes. Well, how do we get there is the issue. And at what cost? And how many dead bodies are we willing to take with us so we can get that silver plaque, or we can get that monetarization?
I like how Homecare Queen poses for you guys to get the point. Like I like how she's very calm and poses for us to get the particular point that she's hammering. The numbers game is very real, and I admit it. Sometimes you wake up and you are scratching your head. Numbers, why? Why are these numbers low? Why are people not here today? You start scratching your head. Is like sometimes you don't even sleep because you're like, no, how can I get to somebody got to 10,000 subscribers? I need to get there as well.
And that's the thing.
Yeah.
The thing about it is, what is your target audience? If you know your target audience, then everyone that comes away from that target audience to support you is a gift. Everyone that comes is a gift. No one owes us a subscription. No one owes us to like us. We would love it. Right now, I would love it. You see what I'm saying? If the person's platform or what they stand for does not resonate with you, does not align with you, you don't have to go on it. Why go on someone's platform to tell them about the pearl that never came to the store? They know. You go there to disrupt. You go there to create friction. Why? Why? We're not going to like everybody. Oh my gosh, I could start a whole sermon on that one. You're not going to like me if you don't like me. It takes time to get to know people. And because we are in the same space and we're doing similar things, doesn't mean we're the same. I was me before I came here. You didn't know anything about me. Does that mean I drop what I stand for and I drop what I believe in to get your subscription? I'm telling you now, I would love it. I appreciate it from the depth of my heart. But if I have to behave a certain way to get it, God bless you. We are becoming a toxic environment. And if someone speaks up for something that is wrong, We attack them, or we have a plethora of followers that decide that nobody's going to say anything about you. I am your guard. You don't know this person from Christendom. I had a brain before I came on here. I had standards before I came on here. I had my attitudes before I came on here. I have my... Not everybody is going to like you, especially if you stand for what is right. It's a lonely world. Believe me, I'm speaking to myself. But that does not mean you have to conform. Why is it that I cannot be corrected because, oh, don't say it. If you said the green shirt you have on, yesterday you wear a red one and I don't like it. None of your business. People are people. People have opinion. People have voices. People can say what they want to say as long as they say it in respect. We don't have to disrespect people to get numbers. And it seems as if there's a whole community. The buses and the bandwagons are full with people just coming at people. It needs to stop, and the only way it can stop is through these type of conversations. Listen, you'll realize that rice is everywhere. Beans are everywhere. Water is everywhere. Look at the amount of people that consume it. Look at the amount, and we still have it. So therefore, there is a big space out here. Each of us can take a piece of that pie and work with it, and leave the other piece for someone else. And this person take the other piece and leave something for someone else. We don't have to put each other down to get numbers.
I love that. That's powerful. That's powerful. I'm going to ask you a question based on what you just said. And no one owes you anything. And, it is very, I'm just like reflecting on it right now, just listening to you. The true essence of you before you came on this platform, before the numbers, before the people, before all these 40 people are looking at me right now, the true essence, that was like literally your true essence. When the channel, and you had a mission. I started my channel as a yoga channel to share with my community, the benefits of yoga practice. I slowly grew my niche into becoming an educative channel, and I'm focusing more on educating nowadays. And sometimes that comes with a certain responsibility. And I've found myself in situations sometimes I find content creators are having a fight. And I'm like, what are you guys fighting about? Do you know, like, you're supposed to be making content? The energy that you're using to fight, you're supposed to be uploading a video. And I always tell them, because I like calling people out sometimes, you're supposed to be making content. You're not supposed to be having these kind of wrangles. And I always say, sometimes you don't even know. I mean, I've not met, I think probably never even meet 99% of the people who are watching me right now. I've met like 5, I've met like 6, but we are scattered across different parts of the world. You find me having like an altercation with somebody in the United States. They've never met me. We met on this platform. We are in different spaces. We run different channels. Why do we get very personal, especially in this particular space? And we forget about the content.
I think that somebody alluded to it in the comment.
Yeah.
We ourselves are not comfortable with who we are. We're not comfortable with who we are.
Yeah.
it can seem like emptiness. We have all these crowds around us, but one of the loneliest places to be is in a crowd. You're in a crowd and you're not feeling any type of bond. That's the loneliest place to be. The other thing is that we're sitting behind the camera and we have a keyboard and we think we have the right to jar people's character. We have the right to say whatever comes to our mind because we're in the same space and we're on familiar ground. No, you don't. You do not have the right to disrespect me because I'm here. You do not have the right to tear others down because you do not stand for what they're saying. Log off. Go take a bath. Get your hair done. Go do something.
Yo.
Why would you spend precious time? This is a sacrifice, Yoga. Goya.
It is.
This is a sacrifice to be here.
It is.
Because I have other plans. So if you come on the Elephant's channel, because I don't want to call names, you come on the Elephant's channel and the elephant is raising his us in a direction that you don't like it, log off.
Oof.
Why is it so hard? You get on somebody's channel to tear them down because you might get a couple supporters? This behavior needs to stop, and it starts with me. It starts with you. Because let me say this. You two can close this mess down, you know.
Facts. We may wake up and find it's not there.
This is not the gateway to heaven. Jesus does not hold the key to YouTube.
Yo, we. Wow.
Somebody's saying here, it is impossible to be a man in this modern world. I don't understand it. I would love for them to clarify that.
Don't worry, Ahmad Sweatpants is having a moment here. And,
okay. All right.
Yeah, it's Ahmad Sweatpants.
What I'm simply saying, guys, respect starts with us. I am who I am because of the challenges I've gone through in life, because the experiences, good and bad, I've had in life, because of the community I have around me, because of the family which is in my community and I've had around me, and having hard conversation with people who you care about is important. But because they're on YouTube and you can see your faces, and let me say again, just in case somebody takes something wrong, which is expected. I mean, if negative doesn't come out of this, we didn't do our work, you know? The fact that we're here together and the fact that I support you and you support me means I respect what you represent, means it aligns with something that I stand for. It doesn't mean I'm going to give you my last born. It doesn't mean that. So if I'm on and you decide not to comment or you decide not to like, it's okay, because tomorrow I might do something that you like. And if we look at it that way, we all are broken people. We all are broken people. However, there are those of us who are working to be our best selves, And then there are those of us who negativity breeds in our life. And let me tell you something. You cannot behave on YouTube a certain way, and then you're going to tell me that's not how you behave in life. Lie to yourself again.
Facts. I was watching an interview with one of some big YouTuber. I admire that guy because I love how he does interviews. And he was interviewing a celebrity, and in the conversation they were having with the celebrity, they were talking about a time they went and they met at a conference, content creator workshop or something like that. And the celebrity was interviewing actually said, have you ever realized that when you meet some people outside YouTube, you're almost like, is this the same person we normally see on camera? Because there's like a change of character. Either they are worse, they talk to people like in a different way as compared to the picture they put on the platform. And that got the celebrity was talking about the importance of being a brand, especially in virtual platforms like this. And they were saying that your character, literally, you can never really hide your character for so long. It will pop out eventually. It will pop out eventually, and people will be like, oh wow, okay, this is what they are in real life. So you can mask it, but there's just so much you can do. At some point it will just reveal itself. Why is it important for us to actually be very conscious about our mental our mental health, especially as content creators, and what is the impact it has on us as a brand? Because one of the things I always have to tell, sometimes I was taking an interview the other day, and I had to tell somebody, we are not celebrities. We are not celebrities as content creators. And you said it. If I wake up tomorrow and YouTube is gone, does that take anything away from me? Does it make me a lesser human being? What will be your opinion, especially when it comes to the power of mental health in shaping you as a brand? And Njeri Kimani was here last Sunday, and Njeri Kimani said something very interesting, that yes, most of us are even in this space and we don't even realize we are brands. We don't even have that awareness. But people are watching you. You don't have that self-awareness that you're a brand. And I was thinking about that the entire week, and I was like, am I positioning myself as a brand? Am I self-aware enough? Because self-awareness is also a very key thing when it comes to mental health. Am I self-aware that there's something I'm building here and people are watching? It's a long, windy question, but I'm sure you got it.
That's before I talk about the brand, then we need to look at how we treat each other in this space and ask ourselves, if someone should show my family member, my mom, my dad, my children, my channel, would I be proud?
Ooh, that's deep.
You see, if we look at it from that space, I think we'll be better people. It's not everything we feel, and I'm learning that we should talk. It's not every emotion that comes up or every fabric that sells in the store we should rip. Some fabrics we should leave alone. Degrading someone because you don't agree with them is just showing who you are as a person. If you have to put someone down to feel important in your space, is sick.
Ooh.
This is a tool. I didn't have an epiphany that I'm going to have a YouTube channel. I saw different people doing it and decided, hey, what is this? So there was somebody before you, there was somebody before me, there was somebody before them. Somebody started this. Meta decided, hey, I can make money off this. These people can help each other. And because we disagree with how the person looks, how they present themselves, you spoke of it about it. This is your brand. YouTube should trigger us into a sustainable business. So if you want people to respect a business that you're going to birth, you have to represent well. Let me not say that, because there are behaviors out there that the channels are growing. So if that's what you want, fine. But if the other person decides that this is not out, and I will not stop repeating that this is not what I want, what is wrong with it? What is wrong with it? As you said, we are not celebrities. We're not. Even if you get up to 10 million views, you're not celebrities. What we are is public figures for our audience. Because I cannot go and sit at Oprah's table. Maybe, who knows, with the right connection. I cannot go and sit on Oprah's table. And I might not see Oprah in the supermarket, but I've seen people that follows me that I don't even know. I was at the airport and this lady kept saying, oh my God, I can't believe it's her. I can't believe it's her. And I'm just going about my merry way. And I went to sit down, and all of a sudden she's coming with 3 people and she has her phone. Look, it's her. And I said to her, hi, what's going on? She says, you're the Homecare Queen. I'm here in living colors with you. I said, thank you. She says, I've been following you. I said, thank you, thank you, thank you, thank you. So when we get those type of respect and accolades, let's not let it go to our head. Just thank God that there's something we share that resonates with someone. You know, if we look at it like that, when we get the praises, embrace it, receive it. When people suggest that we do something, take some time to analyze it and say, you know what, they might have a point. The other thing about branding, if you have a platform that does good and someone interviews you, you're selling a pen, and someone comes and say, I've been buying your pens for years. It's so nice to meet you. And a TV or a newspaper come to interview you. Trying to be diplomatic here.
Yeah.
You do not go on a TV station, a newspaper interview, another content provider is interviewing you. You do not go there and present yourself less than you would want to. What I mean by that, I am from Syria. I am from the tree. and this is how I behave, and you either accept me or you don't. I came up with this because, guys, present yourself well, because you will never know who will watch that. And what you're doing, they might want to contribute to make it larger for you. But the way you present yourself will stop the right person from supporting you. You will get support. But that person who is looking to invest, that person who is looking at tax write-off, listening to what you do in your community.
Wow.
Branding takes registration, license your channel, register your channel, especially if you're in the space where you're doing humanitarian work, you're giving back, monitor the space. And let me say again, the opinions and the statements that are made on this channel are not an attack on anyone. This is my experience. This is me answering the question of the host. I would never and will never attack anyone on their platform or off of their platform. So let me make that clear. My statements are my observation. This particular space we're in is an advocacy for better representation on YouTube. It's not an attack on anyone. I don't have time for it. I'm too old and too cute to sit and attack people. So I just want to make that clear. You cannot do me anything for me to come on a channel and put you down. However, there might be statement that I'm making that resonates with you. It's not coming at you.
I'm too old and too cute. I love it. Guys, I hope you are enjoying this conversation. If you have not subscribed to Homecare Queen, we are on a mission. She only needs 19 to get to 800. I love growth and milestones. Can we make these numbers happen? You're like, how many of you are here? Like 30 people? If you have not connected to the beautiful co-host, the old and cute, I love it. I love it. I love it. Please click on the pinned link and then jump on the other side and go give her a thumbs up and also subscribe to that channel. And then let's get her on her next milestone. You can't be enjoying all this wisdom that is being poured on the live stream and you're not supporting the guest who is sharing this. Do you know do you know how much Homecare? How much? I know you people, content, you people don't come cheap, right? So, speaking engagements and everything, how much would I have had to pay guys to have this amazing awesomeness? If I had paid for it, so you don't get to enjoy this.
About $2,000 to $3,000.
Guys, 2,000 to 3,000. That's literally my entire revenue on YouTube since I got monetized. Yeah, I can't afford that. So it is not every day that you get this wisdom from Homecare. I welcome questions. Feel free to ask her questions. This is not my show. You can ask questions that you have. There's something I like, Homecare, that you say, content providers. It is very powerful. You didn't say content creators. You keep saying content providers, and I'm loving it. And how do we move from thinking of ourselves as creators? Yes, we do create, but we are providing. I love. There's something uniquely beautiful about saying content providers. You're providing content. People come to you because of content. I love it.
Because content creation started when we just came on. So we planned our theme or our name. I'm hoping we decided the demographic and the target population that we're after.
Yeah.
So we at least for me, once I decided that hold on, I have some nuggets that I can share. I have my target audience, and then the other folk that comes in are my blessing. You know, the other people that can appreciate what is sharing are my blessing. So I move out of creator into provider. I'm providing a service. I'm providing, an escape, if you will. You come on my channel, you might see some food that you don't like, and you go, man, that looks ugly, but it pleases you. Or you come on, somebody comes on your channel and they see you doing yoga and they said, he looks so slim and so nice. Maybe I need to add this to my regime, my health regime. So we're providing a service. And if we look at that, then we will realize that branding is important. It's not just important to come on YouTube and chat. It's the branding. When we are off YouTube, we're who we are. We represent who we are. And we never know who is watching.
That's it.
We never know who is watching. So therefore, you're not creating anything. You're selling something that's either going to destroy you or build you.
Let that point sink in, guys. Let that point sink in. Nan Musa, nice to see you. K1 is enjoying this topic. It's like, okay, where was I? I feel like I'm so late. I'm like, no, you're right where you belong. You're right where you belong. Homecare Queen, in your experience as
1 minute, this whole old and cute, I need to make a t-shirt off of it.
Yeah, you need to make that t-shirt. Everyone is loving old. I'm too old and cute. It came out very nicely. It came out very nicely. It came out very nicely.
Thank you, good advice. Thank you, everyone.
Thank you, Kay. Love, Kay.
Okay. Blessed is here, and Winsome is here, and Les is here. And everybody else who the screen is going so fast. I'm not seeing you guys, but welcome. Thank you. I appreciate you.
Okay. In your experience as a home care practitioner and also having worked in the space of mental health, what do you think are some of the, the strategies that we can deploy as content creators just to maintain, just to stay sane in this space? Because you're being attacked, someone is maligning your name, people are doing things that other than content and everything, and it's getting into your nerves and your psyche. What in your experience do you think are some of the strategies we could deploy if I'm sitting as Goga in Kenya and I am not okay in this platform because someone is making me feel some type of way? What are some of the strategies, that I can use just to stay sane in this platform? I do know sometimes if it's very psychological, I know you need to seek professional help. But what if something doesn't sit right with me and my spirit? What do I do? Because there are people who are definitely stuck somewhere. They're like, what do I do? What do I do? Trolls is easy. I can get my moderators. I don't fear trolls. Trolls are very easy to manage. My moderators are very fast. They love it. They love clipping. They love clipping trolls. But there are certain things that, that actually get into your psychology. They get into your thinking. And I keep telling my community every single time, I don't think about you guys when I leave YouTube. I don't. I'm out. The moment I click end the stream, I'm gone until the next stream. But sometimes some of us, it may linger on, and that's what sometimes I don't want to deal with that. What are some of the practical strategies that you could tell these people who are looking at us right now that we can use?
If we look at this as part of our character, again, as I said before, as something that any member of my family, my pastor, any member, the police, anyone can, if they come across it, I won't be embarrassed, or I don't have to justify, oh, I don't behave like that, But that day, once we start to justify things, I appreciate, because honestly, I'm still in awe that I've gotten this far. And it might not seem far to a lot, but to me, this is a blessing. Never expected it. And I appreciate it. I appreciate your support. And I mean it when I say it. Because I don't say things I don't mean. Ask my friends and my family. They tell you she's a bullet. She says what she means, and that's it. I appreciate you following me. I appreciate you subscribing. But what I will not tolerate is disrespecting me. I will not tolerate it. You see, if we put that down there, we don't have to be arrogant about it. We don't have to be rude about it. We don't have to go to the fabric store and take out fabric to rip. Just say, I will not tolerate this on my program. And anyone who thinks that they love me so much that they are going to abuse the people in my chat, stop it. People have freedom of speech, especially in the United States of America. A person can spit out whatever they feel like as long as it's not offensive and breaking the law. So if a person says, I don't like your shirt, one of these days I'll wear one that you probably will like. You see what I'm saying?
Yeah.
The thing is, know who you are. Know where you are. Do not take anything personal, but set boundaries. Set boundaries. And do not encourage people to attack other people on your behalf, because you're just as guilty as them, because it's your channel. And if you don't stop it, you're encouraging it. Silence is support. If you stay silent, knowing that these people are tearing down each other in my chat, you're supporting it.
Facts. I like how people are resonating with this conversation, and it's important for us to have actually discussed these things.
Well, and here is someone. I need to answer this.
Yes.
How about ignore? Maybe this is the same person you're talking about earlier. I don't know. How about?
No. This is Mama Fisher saying, how about ignore the shirt and find something they like?
What? Are you kidding me? No, honey. No, I like my shirt. I'm sorry you don't like it. When I go into the store to shop, I don't like everything they sell, but I'm not going to burn down the store. So I'm supposed to change my shirt so you could like it? Unless it's offensive. Unless it's offensive, I'm not doing it. This is my choice. And these are the things that we do to give up we give our authority to people. No, I'm sorry you don't like it. I got a bunch in the closet. One day I might put on one you like.
Yo, Les will be like, wait.
No, these are the things I'm talking about. You don't have a right to tell me how to dress.
Yeah.
If you don't like it, log off. Because tomorrow you come back on, I might have a shirt on like you that you like. You know, let me just piggyback on this. My hair was black and it was long. And when I got every birthday, because right now I'm going through a hard time trying to figure out what am I going to do with this hair for my birthday. So every birthday I do, as my sister call it, again. and again hairstyle. Something out of the box, something that no one is expecting me to do. When I decided to go gray, I am gray from I'm 28. I have used chloral all my life, and I decided to put her on vacation. And I decided to let the hair just take its natural color. And the first time I posted, I decided I'm going to cut it off because being gray and long would let me look aged, and I don't want that. So I decided to cut it off. And the first time I came on with it, why would you wear your hair like that? Why would you wear your hair like that? One individual went on to say, no man will ever date me if I'm single with my hair like that. I could address it, but addressing it is giving power to the person. It's not everything we have to address. Hold on your power and do not give your power to. I would never come on with an offensive anything. But if I came on in an outfit and you don't like it, check me back tomorrow. You might like that one.
I like that point by Mama Fisher because it actually
yes, I see now. She's playing devil advocate.
I love it.
Yes.
I love how she played the devil's advocate in that point.
Yes.
But home care queen, somebody then would ask, boundaries. Boundaries are not very easy to establish, especially on this social space, and one of the things I always have to battle with, especially as a content creator, and I'm speaking for myself, this again, we say this is a conversation that is reflective of your personal experience, is sometimes I always tell people, never feel obligated to share. If you don't want to share something, you're not obligated to share it, because if there's one part of my life that I still value, is how I can be very private over certain things, my family, certain aspects of my job. But you come on social media generally, and even a space like YouTube, and people sometimes I've gotten concerns. People get, Guga, tell us about this, and I'm like, nope. They get shocked when I don't share that information, because I'm like, that was not the content. My people don't even want to be part of the content, but end up dragging them into this particular content. I don't know. Boundaries is a very difficult conversation. And even when Jerry Kimani was here last week, and she talked about it, because she said boundaries also help you find alignment as a content creator. What will be your answer to somebody who is asking you, but it's very hard to establish boundaries? If I don't serve the people what they want to hear, they will not come next week. They will not come. They will not give me a super chat. They will not join my membership. Let me tell them, let me give the people what they want. But then you end up giving the people what they want, and then they demand for something else. Next time they've moved on, they demand for something else. And you end up feeling so horrible about yourself when you leave the platform. You're like, that was not really necessary. What will you tell somebody who is struggling with this conversation around boundaries?
Okay, so there's boundaries, and then there is choices.
Ooh, okay. I love it.
So let's talk about choices first. I made a choice to come on here this morning. I made a choice to speak of my experiences, to advocate for us to come together if this is your choice. I set boundaries. Didn't I give you some disclaimer? Those are boundaries. It's not hard for me to set boundaries. I've set them all my life. Boundaries stem from what you believe in, how comfortable you are in yourself, how comfortable you are in losing a few to gain a few.
Ooh, okay.
Boundaries come with accepting the negativity, but ignoring the negativity. The minute you address it, you have given your power over to that person.
Ha. Whoa.
Things that we address should be things that can create change and elevate us. So therefore, if you don't like the shirt I'm wearing this morning, why am I going to spend my precious brain cells to try to tell you, well, I wear it because I like it, and if you don't like it, I'm sorry. And then somebody in the chat who thinks that they're my God, and I appreciate, the people that respects me. I do the same for you. They think they're my God. She go, leave her alone. They'll come on here and talk about her shirt. She wear what she want. I don't need that type of support. So if it means that I am going to stay, and God forbid, the blood of Jesus, that I'm going to stay at 800 for 20 minutes, I will. Yes, Kimani. Say that loud. Even in our life, in our relationships, our children, our siblings, our parents, if you don't have boundaries, you live in chaos. You live in chaos. And it seems that this is what's fueling so much stuff. Everybody think that because I'm here and you give me a thumbs up, and guys, give it. I'm not discouraging it. I'm making a conversation. You give me a thumbs up and you subscribe to me, that I owe you. I don't owe you. I'm going to reciprocate because you align with some of the things I believe in. There is an air from what you share that I'm learning from. So be willing to lose subscriptions. Be willing to lose likes. Because let me tell you something. The statement is, if you don't stand for something, you'll fall for anything, and anything is a lot. You see how high eagles fly? You see how high they fly? And what they do, they come down. You never see an eagle walking beside a dog. Have you ever?
No.
You've never seen an eagle walking beside a bird. Have you ever?
No.
So we all have our stages. The eagles are up there. We just have to align ourselves with them. They will come if you make the space. Make the space and they will come. We don't have to dip so low. And I love what you said, until we regret it when we come off. That's no place to be. Make the space and they will come. Because everybody's doing it doesn't mean it's right. It's just common.
Hey, I felt that. Because everyone is doing it, it doesn't mean it's right. It's just common. Guys, I hope you're taking notes, because I am inspired right now. Yeah. That is powerful. But home care, most of us will be scared of being, and it's very often, I've always found myself in the minority, even at work, even in certain situations.
That's me.
Yeah. So and one of the things I even sometimes tell my colleagues, it's okay, I'm in the minority, because this is how I think. I'm not going to sell out because it doesn't align with me. And most of us are scared of finding ourselves in a space where we are not where the crowd is. And
not me.
And
it takes age. Oprah once said, when Oprah got to 50, Oprah said a light bulb go off in her head, and I go, right, if I got your money, I would have chandeliers, not just light bulb going off in my head. That's what I said to myself. But when I got to 50, my light bulb went off. I got to the place where, guess what? I am who I am. I'm willing to change. I'm constantly going to try to grow. Yes, I have my issues. Yes, I have my, but I'm going to continue to grow. And let me hasten to say this. People who have you bracketed a certain way will never see your growth. So if you're waiting for them, you will be in depression for the rest of your life. If you're waiting for them to validate you, persons who see you in a certain light, they don't like you because of the glasses you wear, the way you walk, you talk. If they do not work on themselves to create change in themselves, they'll never appreciate you. I'm not talking about disagreeing now, Disagreeing is different. I'm talking about people who find every minute they're in your presence to lay some negative in your space.
Wow.
You live in depression if you wait to be validated by them. So you have to accept that it's lonely on the top, but there are other people up there who needs companion and needs company, and they'll get to you. What are we willing to lose to gain?
Powerful. So it doesn't really matter, you'll find your company at the top. I love it.
And whatever your top is, and let me say it again. Your top does not mean what you have in your head and the biases you have in your head against people, whether it's education, whether it's nationality, whether it's sexuality, whatever it is. That's not the top. The top is where you are. The top is where you are. So you don't have to dig too deep. We pull up, we don't pull down. Only rain comes down, but sun shines. It's a reason. Rain comes down to kill the viruses. It comes up to kill the viruses and grow the plants. The plants could have stayed down there. But with the encouragement of the rain, they came up. So it clears the environment. But the plants say, oh my goodness, I can grow from you. So find the positive in the negative and stay with the positive and ignore the negative. If your life is disruptive, if you have a lot of pain in your life, if nothing seems to be going right in your life, YouTube is not the place. YouTube is not the place. The place is on your knees. So you're going through, your boyfriend didn't buy diamonds, but he bought gold. And you wanted diamonds, and somebody came on with diamonds. Who do you think she is? Because you got gold, you don't think she should have diamonds? She spent 64 years on the earth before she came on YouTube. Or 24 or 20 or 18 or 40 or 60 or 50. You just met the person. And all it takes is for one of us to be willing to lose to gain. Keep our standard even if our numbers take time to move. Because here's what I have noticed. People can decide that, oh, I don't like her. Boom, they unsubscribe. They can unsubscribe. Maybe they have a channel member that don't like the person. Oh, you subscribe to that and they unsubscribe. So the fact that they unsubscribe, you're going to stop. YouTube take away subscriptions. They took away quite a few of mine. You know what I said to myself? That's just the nature of the game.
Absolutely.
I'm not going to come on the channel and cuss. Oh, I lost YouTube. I lost this and you all are traders and you all are haters and you all are jealous of what?
Yo.
You work hard for what you have and where you are. Likewise, I did. You know, I told somebody I love shopping at the 99-cent store. And I love shopping at Saks and Neiman Marcus and all of the others. The 99-cent store, I buy items, liquids to wash my bathroom, to wash my floor, to wash my carpets. Why should I go to Costco and buy the same thing that the 99-cent store has for $1.25 for $17? I'm not that stupid. So we all do things differently. We do things differently. The areas that you're spending a lot, maybe I'm saving a lot. So that's why my shirt is what it is today, because I saw it on sale and I'm going to save. But that doesn't make me less than or make you less than, or because I come on with certain things doesn't make you, or you take a peek in my house and, oh, you know, Kay taught me something and God bless her because I had no idea. And I'm very careful now. After she spoke to me, I could have gone left with it and say, oh, I do what I want. But no, she's in this arena before me. Likewise blessed. And they put it in the chat, and that's what I love. So nobody can accuse us of having private group. They put it in the chat. Homecare, I want you to be careful. Homecare, please don't do that again. Homecare, listen, guard your privacy. And they put it in the chat. We don't have private groups. You and I don't have a private group. And if we choose to do that, believe me, people, we ain't talking about you. If I'm in it, we're not talking about you.
I love Kay. I love Kay. I love Kay. Kay is very direct, and I've told her this several times.
MG, hi, Homecare, Kay, hi.
I love Kay for that. It's always Kay is what it is. Kay doesn't hide anything. Whatever you see from Kay, that's what you get.
And let me tell you, I'm new here. Yeah. And she knows I appreciate it because I said it out loud.
Yeah.
I appreciate it because she's teaching me. Don't be so trusting and remember what you're saying to us is what I need you to do for yourself. Guard your privacy. That was a gift she gave me. Some people would have taken that and make a mountain. Who are you to tell me what to do? We need to stop it. Guys, the subscription will come. The likes will come. Not everybody loves to go to war.
Amen. Amen to that.
Thank you, Les. You see, the likes will come. If we stop focusing on numbers and start to focus on who we are and what we're providing, I think it will change things.
Thank you. Guys, if you have any question for this lady is inspiring. You know, I just love listening to her because, you know, I like, she's provoking things in me. She's provoking me to think about certain things. She's provoking me to she's making me like appreciate some decisions I had to make that I may not have even said them publicly. And I like that kind of thing because the world needs more of this. The world needs more of this. The world needs the Minority Report. The people who can stand on their own and say, I am not, it's not common, but I stick with my decision.
This is what I'm saying. You know, the people that makes the most noise, you would think that that's how it should go. No. And because you're making a lot of money, money don't buy character. Money don't buy
Amen.
decency. Money buy things. People over things. If we would think like that, people over things. If we put people first over likes and subscription, they will like and subscribe.
I love that. I love that.
Because half of the people who are defending and carrying on, listen, y'all, stop wasting your precious time. Stop. Stop it. Stop letting a certain culture be people saying, oh, those people, they're the worst on YouTube. Stop it. Let's change the narrative. Let's change it. If we were here putting down people, talking all type of mess, this place would have 1 million viewers.
Yes. Yes, it would.
And we have to be able to appreciate the ones that stay with us. If it's 2, I'm happy. If it's 1, I'm happy. If it's 1 million, I'm happy. Once we get there, somebody said the other day that trying to get to subscribers without collab is one of the worst things we could do to ourselves. Sharing with others, co-hosting with others. They said it's a good thing to do.
It is.
But people don't want to do it because, oh, I'm not having her on because I'm going to lose subscription. I'm not having her on because she thinks she knows everything. I don't know everything. I know enough. And what I don't know, I have the resources and the support to question so I could add on to my experience.
Absolutely. I'm a very strong believer when it comes to collaboration, and I've gotten a lot of flack from it. And I never tell people a lot of things I'm told behind the scenes. And I always say no. That's why I keep telling the tribe and the community that you never really lose anything, guys. You never lose anything. You never lose anything out of helping somebody out of collaborating. In fact, the days and this one is a trick. The days I'm not like the days I don't feel like 100%, like I don't have the energy to be on a live stream, I will collaborate. I will get a co-host and make the show about the co-host, and I'll just sit there, yes, and it's amazing because you're also learning. Like, I'm taking notes right here, right now, because I'm also enjoying that particular learning. And it's also there's something about learning from people who have a different opinion than you. People have a different experience. People, I don't cook. I don't even imagine myself cooking it will never happen probably on my channel. But there's something you learn from them, like, oh, wow, okay. Oh, okay. This is something I'm learning from here. This is nice. I should maybe go and try this next time I'm making dinner. And see how they're adding cheese or something. But for the life of me, I will never cook on my live stream because I just don't know.
Because when you cook curry chicken, your curry chicken is yellow, like the sun, and I cook it, and mine is a different color. Don't tell me that's not curry chicken. There's different type of curry powders out there. So mine might be the brown one. The Indian one comes in 3 different colors.
Yeah.
So maybe where I am living, I can't get that bright yellow one. So I get what I can. You see, if we stop these little nitpicking, we'll get along,
We will, 100%. Guys, are you enjoying this conversation? Was it worth it? I've kept Homecare Queen here longer than the time she allocated me. I welcome questions. She literally woke up preparing to come to this stream because like, Goga, that is all in the morning. It's all in the morning, Goga. And I'm like, because she's 10 hours behind. So I said, let's just do it in the morning so that I can release her to go about the rest of her day. So if you have not connected to the beautiful and the inspiring home care queen, the link is pinned up there. She only needs 15 now to get to 800. I think that is very possible. It can be done. As I give I give her a chance. I'm now getting just to the last part of the conversation. If there are any questions on the chat, but I like how you guys have been asking this. You've been giving the comments and asking the questions as we go, so it helps us save the time, at the end. So if you have not connected to her, what are you waiting for? What are you waiting for? Go watch these amazing insights and tips. I always bring you the best people, guys. You always learn. You always, I get you the best people, and they come here and you enjoy. Support them. Support her. I'm coming out to your YouTube channel, which is my last aspect of the conversation. The your YouTube channel. So you've retired after 42 years of working in the medical space. You are now in home care, courtesy of your daughter pushing you and revising that resume. And now you are on YouTube. How did you even find yourself on YouTube? You're a booked and blessed and busy woman. What? Why? And guys, look at that background. When I was preparing for this interview with the home care queen, I just kept looking at her background and I'm like, oh my God, you have a very beautiful background. Is this it is just amazing. She looks like she's ready.
Thank you.
Yeah, she looks like she's ready. And what inspired you to start YouTube? I mean, you said you are a mother, you are a sister, you are so many things. How did YouTube come in?
Well, as I told you, YouTube came in from watching other content provider popped up on my timeline.
Yeah.
And I started to watch, and then others start to pop up, and I started to watch, and then my girlfriend was over, and I'm like, "Do you know they do these things on YouTube?" And I showed it to her.
Yeah.
And she said, "You have a lot to offer. Why not try it?" And if you go back and look at my channel, my first video, oh my God, I think all they saw was my teeth. You couldn't see anything because I didn't have a camera. I didn't know what I was doing. I didn't have a camera. I was using my phone. I didn't have the correct lighting. And, but people were coming. My friends supported me. I have a friend, well, I would not call name because there's so much of them that support me, that has been with me from day one. I know they're on now. They always stay in the bushes. And then they tell me, I saw it. Guys, I know you're on. Come out and like my channel, please. So once my friends started to say, interesting, I like that. I had one friend, you gotta look at my channel, the first video. My background was like a forest. I love large floral arrangements.
Yeah.
And I have this floral arrangement almost 15 years now. When they get a little droopy, I just buy new ones, put in them. I had this thing on the back of me. No, it was on the side of me. Then I have candles. Then I had the kids' pictures because that's how my space was set up. It's my living room.
Yeah.
And my girlfriend said to me, very informative, but I was so distracted. Your flowers are beautiful, but I want to hear you. I want to focus on you. So I start to take it down. And then she would text me and says, yes, I like this better. Keep going. So it's been, a process. And then when another friend saw what I was doing on YouTube and said, you're not Claire. And I says, well, I don't know what to do. And he said, okay, I'm going to get you a good digital camera system, a good digital microphone, and you have the space, so we're going to make the space. So that's how it happened, because I'm still tweaking it.
Interesting. And what has been the experience like, being on YouTube and, what content appeals to you more? Because I like it's Home Care Queen TV and vlogs. I like that because it actually now leaves room to the possibilities. They're
Yes.
endless. You can talk
Yes.
about a lot of things. But you seem to lean more towards cooking, because in my interaction with your channel, you are always cooking, and you have the most amazing you have the most amazing commentaries when you're cooking. Like when someone is listening, I'm like, I don't know that focus on the cooking or what she's saying about the food, but I love the style. It's a very nice blend between the cooking and the video.
Yes, as I said, the platform creation was to inspire, educate, support home care workers to emulate home care in a positive light. It is a profession. It is something we should be proud of.
Yeah.
And while I was doing that, my friends again said, "You're such a good cook.
Yeah.
Why don't you show some of what you do in the simplest forms?" So I decided every time I get a suggestion, and then I think it was on another channel that I realized that when you use the word vlogs, you open yourself to do multiple things on the
Yeah.
channel. So I
Precisely.
added the vlogs. I'm still a proponent of home care providers. I still will give little nuggets on it. I'm saving some of it because I intend to spring into another area. And I don't want to give everything here, then it leaves me without another area to make money. You see what I'm saying?
That's perfectly said as a content creator. It's always like, guys, I'm not going to say it on Google's Live. Wait for it. Wait for the video. You're in for a surprise, and I love that because that keeps the excitement. It keeps the excitement going. And guys, you can see that channel. And on Friday, I was literally screaming at people here when I was doing channel audits, and I told you guys, she has a banner. Look at that banner. Look at that banner. Look at that banner. Look at that banner. You guys, I mean, it is these simple things. It is these simple things. This channel is just like how many? About around 10 to 800 subscribers. Look at that banner, guys. It speaks volumes. It speaks volumes. There's just something. There's some nice character. The profile picture, she's laughing, and I'm already interested in just like, who is this lady? Who is this lady laughing, and whatnot. And look at the introduction. Welcome to Home Care Queen TV. Our goal is to encourage families to look in it. There's something about her introducing the channel, and you can already see that. She put in some effort, and this is what I was telling you guys the other day about effort in how you introduce yourself to the world, because it's premium and it's key. It's premium and it's key. I like doing that so that people see what we are working with, so that they understand.
And can I tell you something? That banner,
yeah,
someone visited me and admired the channel. If you see the other one I had up, I'm telling you, this is a process. And while we were talking,
yeah,
he said to me, "I love your banner, but it's not telling your story." And she and I sat down, and we moved things around, and this banner came out of so many different areas of our thought process. And she said to me, "I'll let it stay, and we'll take it down when we find the right one." But I never got to change it. So I never got to change it.
Yeah.
This one, she says, represents you. But we're going to change it into but we never got to change it. So it's working. So I left it alone.
It's nice. There's a plane there. You love traveling,
I
I
love
guess.
to travel. That's why she put that there.
There's the ocean somewhere in there. There's a crown for a queen. There's a smiley. There are all these. It's very festive.
Thank you.
It makes me think of, I instantly just know that this is a warm place to be, because
Oh, thank you.
it's giving me that bit of like vibe. And the one thing I was telling people the other day when you came for my state event, and I was telling people, and I said it in public, and I like catching good things in people, because that was how my training was when I was when I had to go for my meditation training. And I was told that when you learn to catch the good things in people, it will help you stay away from the negative. And for me, the first time when I interacted with you was when Blessed invited me to help her fix that StreamYard multi-streaming thing. And you came in a bit late, and then you're like, oh, I need to be part of this. And it was a whole ceremony, you setting up everything. And I like how everybody was just waiting for you, and everybody was just
I didn't know what I was doing.
everyone was just waiting for you to like set it up. And and I like how you are not even bothered, because I would really be like frantic, like I'll be having a lot of pressure, because everybody is waiting for you. But you're just there like, Goga, what do I do next? And you still even had the audacity to ask me, and I'm on the chat, you didn't even know me, and you're like, Goga, what else am I supposed to do here? And Blessed and everyone are just waiting. I was like,
that was a day, boy.
and you are so calm. You are so calm out of that storm. Like everyone is like, it's like it's like people have been sitting in a meeting waiting for you. And then you come in there like, and the computer is not going on. The presentation has not been uploaded.
That was a day. Remember this? That was a day. That's why Blessed and Kay and you and everyone else, and Les and Latoya, everybody.
But I like
so patient with me.
Yeah, I like how you. I don't know. That also goes into your character as a person, because do you know that there are people who don't know how to handle pressure? You are not. You are a queen. You are not even bothered. You are like, Goga, what do I do next? You literally said, guys, I will take my time. I loved that. You are a boss. You are a boss out of that storm. I will take my time. What next? What next? What next? What next? Until you're able to finally do it. So I like that kind of thing, and it's a good quality I'm catching. There's something about your calmness. There's something about your disposition. It's very graceful, and it's a nice thing. It's a very good breath of fresh air, especially in this platform. And I just want to say, keep it up.
And it gets me in trouble. That's why it gets lonely sometimes.
Keep it up. Keep it up. Keep it up.
I don't take myself serious.
Yeah.
So, when people say things the way you say, it means the world to me. Yeah. And it shows me that God is in control, and I'm not perfect, but I'm trying to grow, and to grow in His likeness. Absolutely. And, when you're in a space like this where you are who you are, and it's not liked, and even in personal life, I'm consistent across the board. I'm not like this here and then I'm like that here. When I'm asked to do something, I do it from my heart. I do it because I want to do it, But as I said to you, don't be afraid when it gets lonely because you're standing on principles or you're speaking up. Holy quieters seem to be, they're supposed to be appreciated, but the big mouths like me will not be. You have a right to be who you are. Likewise, I have a right to be who I am. And you see, if we look at people like that, we'll behave better. Absolutely. You have a right to be who you are. If you want to ride a donkey and I choose to ride a car, it's still transportation.
Wait, I want you to use that one in terms of a flight. I want to attack some people here because of the rain thing. Say it again.
You can make a donkey fly and not use an aeroplane, go ahead. But because I use a plane, don't mean you come at me.
Yo, wait. Everyone on the chat is just like, yeah, guys, let it sink in. Let that point sink in right there. I know. It's transportation.
We have a right to be who we are. Not because I'm in your presence, I'm supposed to change to you so you can feel powerful. And why should I? Don't get me wrong. I'm up for growth. If I do something that offends you, I am the first person to come to you and apologize. And I'm apologizing without justifying. A lot of people hurt us, hurt our feelings, and then they say, well, this is who I am, and my friends love me, and the dog loved me. Well, you wasn't lovable to me. So if you hurt me and somebody tell you what you did was wrong and you're coming to apologize, just apologize and stop justifying yourself. It's not about you, it's about you hurting me.
Kay, leave me alone. Kay, leave me alone. Kay, you missed your premiere because you're busy here collecting receipts and listening to Homecare Queen. She's a queen. The queen is here. So if we're all listening to the queen, we all missed your premiere as well. You can like pull it down and then schedule it after. You can schedule it after. You can, before people see it, you can pull it down and then upload it again.
Yes, Kima, it doesn't matter. You see if we can understand that?
Yeah.
When I first started working, my first job was Burger King. That check, I had it framed for years, and in moving, I misplaced it and it hurt my heart. It was in the center of my living room. I was so proud of that $25 check, 40 hours for $25. And I became the best burger slinger.
Wow.
That's my best job experience. Then I moved up to cashier. Oh my God, at that age, I felt like I was in the White House, being the White House chief assistant. So find our space and be happy with it and allow people to live.
I know. Guys, I don't want to release this bit. I could listen to Homecare Queen the whole day. Even some people are missing their premieres. That's how powerful.
No, we don't want that. We don't want that.
No, just
we're gonna break.
It's amazing, and I just want to say we are honored for you just coming to hold the space and share with us these nuggets. And but yes, guys, I have to be respectful of our time as well. And thank you so much for the support you've given her on her channel. Thank you so much, guys, for listening to me and going to watch. Kavi, have you connected to Homecare Queen? Kavi, have you connected to Homecare Queen? Get out of my live stream, go to her live stream as well and give her a thumbs up there. How many thumbs ups does she have, Anne Maura? Just let me know.
30. I'm 30.
All right. And then David Hunt is asking you about David Hunt. What was David Hunt? David Hunt, leave me alone. David Hunt is asking you about David Hunt. She was born. She was born in Jamaica. David Hunt. This question may backfire on you. She was born in Jamaica but raised in the States. David Hunt is asking you. Okay, let me just ask. I'm going to paraphrase the question. I don't want to ask the way David asked it. What is your take on okra?
On what?
Okra.
What is okra? Oh, the vegetable?
Yes, the vegetable.
I love it. There's a bunch of okra. What does it mean? Is there a joke that I'm not getting? Is there a joke I'm not getting?
No, you've answered the question. You don't even need to explain anything. I'm just laughing at him because it has backfired on him. We have a bet with David Hunt.
There's a number of recipes on my YouTube how to make the perfect okra. I hope that's what he's talking about, David. Long live okra.
No, that has backfired on him so badly on the second week running.
So Roya, welcome.
That's why I'm laughing like crazy. Oh my goodness, David, yeah. I'm sorry. This live stream is powered by okra. Homecare has already answered your question. I am not going to ask anything else. Homecare has answered your question. I am not going to push it further. She answered the question. Go what? I mean, look at her. She's even made some okra stew on her channel. Just go check it out. You'll find some okra meal. Yeah, I think I watched an okra meal there. And then David is asking, is okra good for mental health?
Well, what I can say to folks, I do not suggest anything for those things, because I'm not your practitioner, I'm not your dietitian. But whatever works for you, use it. Whatever works for you, use it.
Well said, well said, well said, well said. Thank you so much, Mish. Mish is the daughter to Mama Fisher of This Is Us and What We
Oh,
Do.
welcome.
Yeah, so This Is Us and What We Do. The entire family is here, pretty much. Okay, and yeah, you guys have finished me, and I think that is a good sign. If there's no question, I'm just going to give Homecare Queen a chance just to wrap up her thoughts. I'm going to ask one solid question that is going to capture the two topics that she was tackling. When she started the live stream, she's really given some amazing insights when it comes to home care, and especially, and I think she gave a very good advice to people who want to get into that particular space. And she really solidified her 42 years of experience and how it has really helped her in that particular space. So I'm going to just ask one thing, and this is literally just a wrap-up question. It could be an advice from a place of experience, just the final tips and the last advice, especially for people who want to people aspire to be home care providers. And the last thing will be, how do we as content creators keep the mental health conversation alive in our little spaces? How do we keep being advocates? Because I like the term advocate, and you're the one who educated me on this. How do we keep advocating for mental health in our little small spaces so that we make the community a safe haven for each and everybody who interacts with us? So there are two. It's a two-pronged question, but I'm sure you're going to capture it very nicely as you give the wrap-up. And I will put you on solo layout for that, just to put the focus on you and advise anybody who has not connected.
Stay with me. Stay with me.
I'm here. I'm here.
Yeah.
Okay. I thought I should make you so that you look at least alone like this for a while.
No. I love the other way. I love the other way. Go back. Yes.
All right, I'm here.
So first, as I said before, for those who are just coming in, how do we create a safe mental space as providers? Setting boundaries, not being afraid to lose a few to gain others. If there's something that does not align with who you are going on in your chat, pause and stop it. Pause and stop it. And you don't have to do it aggressively. You just say, on this channel, I will not accept bullying each other. Everybody has an opinion. You don't have to agree with it. As long as they're not offensive, let them speak. So if each of us start by doing that, the other thing is, when we are criticized, put on earplugs. Come sit in the palace. Come up near. Come near, guys. Sit in the palace. When you are criticized, it does not mean the person hates you. It just means they're in that space for the day. It does not mean they're jealous. Jealous of what? We don't know you. I think if we get that, you're seeing a frame. Go Goga loves my frame. That's nothing for you to go on a rant about. It's nothing. This is who I am. This is what I like. Look at his frame. I love it. It's so cultural. I love it. So it doesn't have to be pleasing to you. Listen to the message. Stop majoring in the minors. If there's a reason why you're on the channel, to gain something, focus on that. Focus on that. If you disagree, don't attack. Make a statement. Make a statement. We need to stop pulling each other down. When you look at YouTube and see some of the mature people and the behavior, I said to myself, how do they go through their door afterwards? How do they go to work? How? You don't have to like me. But what you're going to do is respect me. You see, once we do that, we are going to lose some. But remember what we said in the beginning? Eagles don't walk with dogs or birds. They fly above. There's enough space for all of us. Growth is important. Growth is important. Support is important. I would not be here without those who decided that, listen, I'm going to bring the newbies along. I'm going to bring them along. I'm going to introduce them to my space. Where would we be? And if you choose not to be in that arena, it's your choice. We are not a cult. We are not against you. We're just building a community. Stop taking things personal. Stop being paranoid. Because a certain sector support this and a certain sector, we're not against you. We're just trying to find a balance. And if this is not for you, stay in your lane. Stay in your lane. But be willing to lose to gain. Do not carry dead bodies for popularity. Don't do it. And if each of us on our platform continue to advocate for respect, decency, and patience and mercy with each other, we will be such a better space. Find the corner that works for you. Find that not everybody is going to work. And because I decide that this corner is mine, I'm not against you. It's just not for me right now. This is not eternal salvation. YouTube is not the gateway to heaven, but it can be a gateway of respect and peace. Thank you guys for your time. Thank you, Goga. Thank you. I respect you for inviting me on. I was a little trepidatious, but I thought about it. And I'm willing to lose to gain. It was my pleasure. Thank you guys for your support. For those of you who has been here for the beginning, I never stayed on YouTube this long. Thank you. I appreciate you.
Thank you so much. And you remember when I was telling you earlier when you were having the pre-live preparations, and you're like, oh, Google, 1 hour should be good, and you've been here for 3 hours. Can you imagine? You've literally
never imagined that.
So I don't take it for granted. Thank you so much for really, this was an idea, but I am so honored that it came to fruition. And I just want to say thank you so much for really gracing us with the space. And you could have been doing other things. You're a busy person, but you honored the call, and you gave us your nuggets of wisdom. And we are better people because of this conversation. And I always say, it always helps, because they always say biblically that an iron sharpens another, another iron. And I'm so happy that based on the input and the nuggets of wisdom you shared with us, we are much better people. We have a much better understanding of why we need to be advocates, not just for our mental health, but also the mental health of other people. We are better purveyors of the work that goes into home care. And we don't just assume that it's one of those things, that it's a lesser job or anything like that, but it's actually a life of service. And had you not been on this panel to shed that light, we wouldn't have understood the work that comes with that responsibility. Heavy indeed is the crown that you wear, and we are just honored that you gave us that bit of input. I hope I've not missed any question on the chat, just in case, before I release the gracious co-host. And I think I've carried that. David is highlighting for us the moments of wisdom by Home Care Queen. Do not carry dead bodies for popularity. And the other one, just because something, just because something is popular doesn't mean that it is right. It's just common. Coach Merima coming out of the bush. This is my channel member, honorary channel member, very respected channel member of mine. This one is always hiding in the bush. When Coach Merima comments on your, just know she's been moved. Coach Merima has actually commented at Home Care Queen's channel. She was moved. She likes hiding in the bush. She doesn't even like that, she doesn't like that attention. Now she's like, Goga, why are you like this? Goga, why are you like this? I just wanted to crawl in and support the lady without you calling me out. But I love that lady. I always have to call her out anyway. So, and they have the same grace. You guys have seen Coach Merima on the panel, and you see Home Care Queen. They're literally, I think they should be friends, and I think they're going to be friends. So thank you so much, Coach. She's laughing because she knows I've called her out there. So thank you so much, Home Care Queen. It was such an honor, and I'm so honored to have really benefited from this. Guys, did you enjoy this conversation? If you enjoyed this conversation, can you drop some hearts? Drop some hearts on Home Care Queen's chat. I want to see hearts on Home Care. Oh, yeah, thank you so much, Bita. Sure, I see your heart there. Drop those hearts before I release her. And then I will be able to end the live stream on her side, and then you guys can jump. You can jump here. You can jump here so that we can send people on a raid and sign off and end the service.
Thank you. Have a wonderful week, everybody. See you on the streets of YT.
All right. Thank you so much. I want you to say bye real quick alone, because I'm going to end your live stream on the other side. Yes.
Okay, bye guys. Thank you for coming here. Thank you for giving me the opportunity, and see you soon.
See you. Bye guys. If you're on Home Care Queen's side, please jump over and come back to the service, and then we can end things from here. All right. I wanted to keep that content. Okay, this is the affirmation. Your impact on other people is bigger than what you think. Someone still giggles when they think of that funny thing you said. Someone still smiles when they think of the compliment you gave them. Someone silently admires you. The advice you give has made a difference for people. The support and love you've offered others has made someone's day. Your input and opinions has made someone think twice. You are not insignificant and forgotten. Your existence makes a positive difference, whether you see it or not. I'll repeat. You are not insignificant and forgotten. Your existence makes a positive difference, whether you see it or not. This was your host, Goga, the Sunday service. It was such an honor having you in this platform. Thank you so much for always gracing me with your presence. Thank you so much for being part of these conversations. May you have a significant and powerful week ahead. I will see you on Wednesday. Thank you so much for the space. Thank you so much for the time. Take care of yourselves and enjoy your flight to Walters. When we land there, just type the necessary. Right. I love you guys. Take care of yourselves.